Good morning, everyone. It's a pleasure to be here. My name is Dr. Andrew Park. I'm an emergency physician, and I'm the president of the Ontario Medical Association, which represents over 43,000 physicians across the province, and therefore makes it one of the largest medical associations in the world. It's a pleasure to be here with my fellow panelists and have a discussion around healthcare. As we know, healthy patients make healthy populations, make healthy economies. So it's a really interesting time in healthcare. We're really here to talk about the challenges that we've come through and the current level setting of the system as we see it today, and how we go forward to build a more resilient, a more sustainable, a future-proof global healthcare system, and continue to be amongst the leaders in the world in that. So I'm going to have my panelists introduce themselves, actually, and what I'm going to get you guys to do. Introduce yourselves, tell me a little bit about yourselves, but also tell me what you think is the future state of healthcare and how in your individual roles you see yourselves or your companies or your industries contributing to that.
Thank you, Dr. Park. My name is Dana Siddle. I am a partner at McCarthy Tétrault law firm. We're a national leading full-service law firm here in Canada. I'm also one of the co-leads of our health industry group at the firm, and I'm very delighted to be here with industry leaders on this panel. With respect to the future state of healthcare, we heard in the introduction, I think the approach that we take now will have an impact on the future of healthcare for decades. What that could be or should be, I think, is a healthcare system that is accessible and resilient. I think that could include highly skilled medical professionals that are supported and complemented by scalable tech solutions that are deployed in a careful, responsible way with respect to data governance, reliability, quality. In terms of my role, I think, as a law firm, what we can do is support our clients to remain competitive and compliant as they navigate the challenges that we're seeing in the industry and take up new opportunities to help the situation. Now more than ever, I think. Organizations in the healthcare industry need exceptional legal strategies to approach these challenges and mitigate risk as well as find opportunity. McCarthy Tétrault has a leading team of top practitioners that work in all sectors of the health industry group. So we have lawyers that are leading lawyers to pharmaceutical companies, life sciences companies, global leading intellectual property experts, and real thought leaders around data, governance, and AI.
Alexis?
Fantastic. Well, good morning, everyone. It's great to be here. Thank you, Dr. Park, for the intro. My name's Alexis Smirnov. I'm a Chief Technology Officer of Dialogue, and Dialogue is a tech-enabled services provider. So we provide health and wellness services to organizations by using this common platform where the services are hosted. My background is really a technologist, so technologist in the areas of big data, AI, cloud, and it's only 7 years ago I've co-founded a company in healthcare with the idea of applying technology to the sector and really rethinking the experience of patients. To transform it more towards a consumer experience of consumer products and services. And so now that we are serving about 15% of Canadian population and expanding internationally as a technology provider, we think that our role to future-proof the healthcare system is twofold. One is there is a tremendous opportunity to increase sustainability of the healthcare system by using technology. There is so much efficiency that can be drawn from applying technology to healthcare that we view this as a tremendous opportunity. And the second is this platform approach. Healthcare is extremely complex. The needs of people are extremely complex throughout their lifetime. And so one needs a platform to host not only the basic services like primary care and mental health treatment, but the specialty services, all the future services on a common platform that is built around the patient needs and the consumer experience. And so we're working on that as well. So those two things, I think Dialogue kind of contributes towards making healthcare future-proof.
Thank you very much. Dr. Agnew?
So I'm David Agnew. I'm the president of Seneca Polytechnic, which is a Toronto GTA-based post-secondary institution. So I'm thinking of my healthcare cred. We've got the largest nursing school in Canada. In a previous life, I was with the government of Ontario, where, of course, a huge part of the budget is spent on healthcare. I was privileged to be a member and then the chair of the board of directors at Sunnybrook Health Sciences Centre, and today I'm the chair of CADTH, which is the Canadian Agency for Drugs and Technologies in Health. So I'm a civilian in the healthcare world, but I've had lots of interactions with it. And all of that, of course, just I think should remind everybody, at least everyone who's a Canadian, how complex the Canadian healthcare system is. We have a shared jurisdiction amongst governments that was highlighted yesterday by the conclusion of the Federal, Provincial, Territorial Ministers of Health meeting down in PEI, and they issued a communique on various important topics. All the stakeholders involved, the public-private mix, and of course, ultimately, very importantly, the patient perspective, which is, I think, more present, but not present enough in most of our healthcare discussions and decisions. So I think the reason I'm here is because of the kind of the HHR issue, which is this huge health human resources issue. We all have either experienced, read about it, or know somebody who's been through some of the challenges of trying to find a doctor, trying to get an appointment for a specialist, these long waiting lists, all worsened, of course, by the pandemic. And so one of the provincial health ministers came out of that meeting yesterday and said the three top issues in healthcare are staffing, staffing, and staffing. And as much as I'd like to say that's true, because we're in the job in the world of providing healthcare professionals, it's actually, of course, more than that. There's lots of issues. So when I think about the future of healthcare, and again, from the different angles I've been able to see the system, I think we need to move to a team-based approach. I think, and Alexis is a great example of this, I think innovation and flexibility have to be at the core of how we work with our healthcare system. And I think we have to step back a little bit from the medical, the disease illness side, and think of it much more. And you started it, Andrew, with, the healthy people create healthy societies and healthy economies. And so we need to take that much kind of more wellness perspective on our future healthcare system.
Yeah, thank you for that. There's a couple of things where you can't underscore enough. Number one is the complexity of it, but number two is the difference between healthcare outcomes and health outcomes, which are different things. We think about, mortality, infant mortality, all these are metrics, and absolutely they're incredibly important. But I think we need to, I agree with you, step back and take a more holistic view of what health means to people. Dr. Khayat.
Good morning, afternoon, everyone. So I'm Zayna Khayat. I've got a few roles, so I'll link them to where I see the future of health care going. I kind of summarize as three words. It'll be not only preventative, but we have a new medicine called predictive medicine, which we couldn't do before because we didn't have the data. So it'll be predictive. We'll catch stuff before you even know you have symptoms. It'll be decentralized. So a lot of the platforms like Dialogue does, it'll be clicks and then a little bit of bricks, not what we do today, which is make people go to places. So it'll be decoupled from place. And it'll be digital, seamlessly digital and physical. It'll be continuous. So right now it's very fragmented, very siloed, nothing talks. We don't need to do that anymore. That trade-off is not there. So information and processes will flow. It'll be what I call people-powered, not patient-centered. You and I and our families will call a lot of the shots, or we'll be in partnership with our clinicians and a third new member of the healthcare team called AI, which we'll talk about shortly. And it'll be we'll start to be able to pay for health, what you talked about. We'll be able to pay for results. And today we pay for inputs and activities and procedures. So that's where it's going. The train has left the station. So my job to get us there, I've got 3 main roles. I'm Deloitte's first ever healthcare futurist. So I guide all the organizations we work with and our teams and keep a working point of view on the future of healthcare to help make sure the choices they're all making today and bets they're making are at least consistent with the unfolding future. I hope some of the organizations we work with, they're going to help accelerate us to that future. I find in Canadian healthcare, we love to protect the past, and my mission is to protect the future. My second job is a professor of health sector strategy at the Rotman School of Management at University of Toronto. So I teach a course in healthcare innovation to our global health MBA and our executive training. So my job there for future-proofing healthcare is to breed the factory of leaders to be our shift disturbers of the future. And my third job is I work with a few tech companies, but the major one is a company called Teladoc, which is a global virtual care company. I also work with a menopause care company. So I got to be on the ground rolling my sleeves, helping figure out how to actually change care.
I like that. I like that idea of protecting the future. I think that we do cling to the past in terms of what has worked, and then try to apply that to the future instead of thinking outside of those boundaries and thinking about how we can do things better. And as David said, step back, work with other members of the healthcare team. I want to talk a little bit about. I mean, I'm biased because we represent 43,000 physicians. We're their main advocacy body. So. And I talk to physicians on the ground all the time, and we're talking about burnout, the moral injury that comes with working in a system that doesn't allow them to do what they trained to do. So I'm particularly clued in on the workers. We'll change the perspective and narrative to patients in a minute, but I'm going to start with the workers, and maybe I'll start with you, David. As you talked about the incredible attrition that you have as an educational institution. Of keeping people actually going into the fields, let alone us keeping them in the fields. Can you comment on that and see how we can have a discussion around healthcare workers, keep them motivated, keep them engaged, keep them wanting to do this work for a sustainable future?
I think this is going to sound really basic, but I actually think it starts with talking to the healthcare workers. I mean, I think a lot of people talk about the healthcare workers. I don't think a lot of people talk to the healthcare workers and really listen to what the working environment is, the culture, and it's. I mean, when I talk to for instance, our nursing faculty, that's the kind of message I get from them, because most of them are also working nurses as well as teachers. And so I think it really has to start with that. But again, I would sort of step back and examine, and you touched on this. We're asking a lot of healthcare professionals to either stay within some very restricted boundaries that maybe we should have a look at in terms of the flexibility of who does what in the healthcare world, and in certain cases we're also burdening them with an awful lot of stuff that shouldn't, in this technological age, they shouldn't have to do. I mean, we've mostly moved on from paper-based systems, but people just spend a lot of time on keyboards. Maybe they're not with pen and paper, but they're spending a lot of time filling out forms and so on and so forth. So I think there's a lot of work that we can do to streamline. I think there's a lot of work we can do to re-examine the roles of when we talk about team-based care, what does that really mean, and who does the care? And I think we have to tackle the culture because a lot of that frustration that you hear is based on the culture. And I see you smiling because you work in a hospital.
Yeah, I mean, that's always been one of the topics that's really hard to broach, is even culture within the profession, within physicians, within nursing, and then how those cultures intermingle with one another within the broader sector is an uncomfortable position to broach. Alexis, do you have any comments on how we can best support our healthcare workers?
Well, certainly, it starts by talking to healthcare workers, and I have this amazing position of being at a company that is both a tech company and a service provider of care. So it's a care provider. So I get to talk to my colleagues who are on the front line providing care to patients, to our members, and not a single time I've heard anybody say, I went into this profession because I love filling up spreadsheets and I love organizing data and I just love process. No one said that. Everyone says, I went to this profession because I love to care about people, care for people. I'm a highly empathetic person, and that's my calling. And so then you're like, wait a second, but half of your time goes into doing this work that you consider to be not your calling. And so what's wrong with that? And so that is where we draw inspiration, where our tech team draws inspiration from. There is tremendous amount of opportunities and existing technologies that can, in fact, eliminate that mundane, formulaic work and give more time to physicians, to nurses, to specialists, to spend that time with the patients, creating those human connections. And so when people talk about technology as something that creates a barrier to empathy, or creates some kind of a robotic experience, I don't see that. I see a technology, in fact, doing the opposite and giving more time to providers back to care for patients.
Zayna, you've talked in the past about what, orienting the work to the individual and where they're being driven from like at a base level, demand management. And can you comment on how you see that overall with the different roles within healthcare? Because and part of it is that we are working in at a bit of an environment of austerity, and so the physician has to be the social worker, has to be the pharmacist, has to be the nurse, has to be the scribe, all these things. How do you see that supporting the worker in the roles that they're destined to do or defined to do? Because you're right, no one went into medicine to fill out more charts.
Yeah, or go to meetings. So I lead Deloitte's Future of the Health Workforce, so I know too much about this topic. So we're in an economy audience, so let's just do a little bit of numbers. We spend about $330 billion on healthcare in this country, 70% from your taxes, and about 70% of that is labor. So we treat healthcare like we treated agriculture. When agriculture, in an agrarian society, every one of you had to work in agriculture. That was the only way we could feed the people. Well, countries like Netherlands, and I know they're here, they've quantified 1 in 6 of their workers in their country are healthcare workers. If everything keeps going the way it is, it'll be 1 in 4. It's actually economically not possible nor necessary. So I think, the way we think about it, and you mentioned the words, demand management is so important. I find the mindset in Canada is, people are getting older and sicker. Let's just add more and more and more, build more med schools, train more nurses, steal the talent from the Philippines and from Nigeria, that their countries built this talent and we're going to bring them over here. We are not going to hire or recruit our way out of this. It's got to be demand management. So the first thing is remove the low value add work. Our estimate is 30 to 40% of that $330 billion, which is mostly done by labor, does not need to be happening, period. So get rid of the low value add work. And then, as we've heard, redistribute who does what work. And I think 30 to 40% could be done by machines. Then we won't have a labor problem. No matter what happens, every worker's job role changes, everybody in the future of health. And so the new discussion should be more about how do we guide and evolve every type of health worker to the future instead of what we do today, which is how do we create a culture to retain them? That's a path to nowhere, in my opinion.
Yeah, I reflect on how slow we are to react to the pace of change in healthcare in general. So I love the conversation and where we're talking about, work smarter, not harder. We don't need to just keep piling on different fragmented solutions. The problem I have with that concept is I'm not really sure how, when we have such a regulatory environment that frames us in the work that we do. So I'm going to turn this to Dana because you're an expert in this area of working with that regulation. Can you help us understand how we might navigate some of these fundamental changes that we think we need to make, or we know that we must make in order to, as Zayna said, protect the future?
Absolutely. And, when we talk about the labor shortage and, doctor shortages, longer wait times, more debate circulates in Canada about the merits of a private sector system or a parallel private-public sector system. And so as part of kind of setting a context for some of the comments that will follow on the panel around innovation and what are our ideas for moving forward, we thought it would help if I kind of set some context on that regulatory framework. So Canada's public healthcare system for the delivery of medically necessary services is established under a framework, under a piece of federal legislation called the Canada Health Act. Under the Canada Health Act, there's a complicated framework that's established that involves federal governments, provincial and territorial governments. So under this framework, the federal government is responsible for establishing healthcare standards and providing funding. And then it's the provinces that are responsible for administering the healthcare system and delivering health services to the residents of the individual provinces. And as part of this framework and criteria to continue to receive your funding, the provinces need to ensure that they are rolling out and administering this system according to those rules under the Canada Health Act. And one very significant requirement for Canada is that there can be no extra billing or user charges for the end user of medically necessary services. And so, we're left with this excellent framework, ideology in terms of accessibility for patients, but a challenged situation given the demand and the wait times. There's a recent Supreme Court of Canada decision, actually, which really enshrines this as our go-forward situation. There's a group of clinics in British Columbia that for a decade have been challenging the constitutionality of that Medicare Protection Act in British Columbia, which reflects the requirements and the criteria under the Canada Health Act. This group of clinics argued that because of the wait times that patients are enduring, effectively, the Medicare system is a breach of charter rights in that it goes against a person's right to life, liberty, security of the person, equity, equality. The Supreme, to cut through the kind of decade-long story of it, this past year, the Canadian Supreme Court decisively concluded that it is not unconstitutional, meaning that the kind of status quo on public sector delivery and the criteria around no extra charges at the user level is the decisive conclusion. And so, with that said, we kind of move to the next part, which is we've got this framework. How will we innovate and move forward to address challenges? There, as we all have followed news, there was Healthcare Summit over the last year where all of the provinces' premiers met to discuss this. There's, calls for more funding from the federal government. There has been more funding committed, but individual provinces have also been announcing new regulatory changes as preliminary steps to addressing capacity demands at the primary care level. So things we have seen include additional seats in medical schools and nursing schools, new medical schools in Canada that have been announced and will be built. An increase in the scope of practice for pharmacists, which basically means that the pharmacists have the right to prescribe medication for common ailments. In one province, even to take blood samples for an analysis and confirmation on appropriate drug prescription. We've also seen streamlining of licensing for foreign trained medical professionals, an increased number of associate physicians and nurse practitioners into the system, and changes to the payment model for family doctors. So instead of just being paid by number of patients, it's also going a model that will take into account time spent, the complexity of the caseload, administrative costs for the doctors.
So there have been some changes, and I feel like healthcare in Canada is, every election in Canada, it's healthcare and the economy, right? Like if not 1-2, they're 2 and 1. And so they're so intertwined and linked. Alexis, as you've gone through your time navigating through the regulatory issues, can you talk to your experience about how you've been able to walk through that, or decide not to and go to a different market, or what were the considerations that your company made in terms of how you navigated all the complexities that Dana talked about in terms of the payment, provision, and then being a provider?
Yeah, at the outset, we viewed the single payer system that we have in Canada as fundamental, as aligned with the values of this country, and that led us to consider it as a partner and not as a competitor. Rather than seeking conflict, rather than saying this is broken, we alone know how to fix it. We took a different route altogether. We built Dialogue as a complementary partner to the single payer healthcare system we have, and it works in two ways. It's complementary because it actually saves the healthcare system money. We save about $52 every time we see a patient on Dialogue. Because of our efficiency, because this patient is not going to end up, hours waiting in a walk-in clinic to get a service that could have been done over virtual modality. So that's one aspect. But there is a second one. We have, because we are distributing our services to businesses, and our members never take out a credit card to pay for healthcare, we have effectively opened up a new stream of funding for healthcare. The employers who care about the health and well-being of their employees are now participating in funding healthcare services through the benefits budget. And that is quite fundamental because it's certainly an element of achieving sustainability is not only using our taxpayer dollars to fund the system, but really have other players participating in creating this distributed and more vibrant system with different choices. So there is a way to make a difference within the context of our current regulation.
Now, I'm gonna maybe say something a little bit controversial about technology in medicine. I've been doing this job for about 16 years, and I went from paper to electronic medical charting. And the more I've used technology to aid in what I'm doing around patient care, the more I've been in front of a computer and not in front of the patient. And we've really felt that in medicine, and it's, again, part of that, I don't think this is what I'm supposed to be doing kind of phenomenon, and that adds to that 1,000 cuts that we as healthcare workers experience. And sometimes it can feel counter to what we feel we're supposed to be doing. Zayna, do you want to comment on that interface of how technology can aid as opposed to, it feels like sometimes it's pulling us away?
It's interesting. I don't know if it's this year, but OMA, one of your strategic pillars or something was to remove the technology burden of healthcare. And I honestly haven't seen any other profession in the whole world where that's a priority, right? Because the whole point of technology is to replace labor wages, to free up those humans to do what only humans can do. And that's, Alexis works in a virtual care company, so do I. That's just not what we hear from our clinicians. Like, we create amazing experiences. And so I think, where technology is adding burden and we're actually spending human time on fixing that problem. It's a problem of design and how, either the technology was designed wrong, the rollout was wrong for, so let's fix that problem. But normally that's not the case. Health, which is the biggest kind of future health conference, just ended in Las Vegas this week. I just saw the data came out. 20% of docs on their own are using AI in everyday practice. They didn't need a big implementation of software, change management, 100 hours of training. It just makes sense. And so they use it just like docs, whether they want to admit it or not, use WhatsApp to communicate to patients because it works. So I think, good design technology actually improves the humanity of healthcare, and that's been evidence-based and proven. So I just think it's a Canadian problem with basically our electronic medical records. I don't know what the others think.
I would agree, David. I'll go David, and then David.
Yeah, I mean, I think part of the problem, and it absolutely speaks to design, is we're kind of placing these technology systems on existing rather than stepping back, looking at the system and saying, do we need to do this? Right? So like I say, instead of filling out a form, you're now on your keyboard. And so that's, again, go back to the complexity of the system. I mean, the list is very long of everybody who has to come to the table and be willing to change. And we haven't really got to that point. The one time I guess we really saw that was in the pandemic because we had to. But what I really worry about is that we're slipping backwards. And so all the governments, all the regulatory colleges that regulate the professions, all the private payers, the insurance companies, it's just like the list goes on about the folks who have to basically take a fresh look at this and say, how can we use this to make it better?
Yeah, I think that's a great point. The pandemic gave us all a shared mandate. Right. And then it feels like we kind of pulled back and entrenched into our preset positions. Alexis?
Well, yeah, I just wanted to pick up and highlight Zayna's point about design, and you mentioned it too. We will live in the world where all of us have amazing consumer experiences on our phone. We use them every day. We live with them. We can get a place to stay in anywhere in the world with a tap of a finger. We can get a cab, in a few minutes. And then there's healthcare. And nobody kind of puts healthcare on par with these amazing consumer experiences. And there is no fundamental reason other than attention to product design and attention to consumer experiences. In fact, we even don't use the word consumers in healthcare. We use the word patients. And we're going to talk about prevention, where that word even doesn't make sense anymore, because you want to actually engage with a person who isn't yet a patient. So they're fundamentally we're fundamentally creating a consumer experience through design, and that's the way to think about applying technology and kind of reflect on the differences between why in healthcare there's these callings of kind of removing technology or technology as a kind of a barrier to delivery of great care, because we're just severely underinvesting in consumer experience design.
Yeah, one of the issues that I see, and I think the public gets worried about, is how far that innovation goes. AI, like we're talking about AI, right? How far that innovation goes and what that means for us, and how do we create guardrails for that? Because people are concerned around what that means for data privacy. And I realize we're at like the end of the start line of the race for this. Like we haven't even hit the track yet. So, Dana, maybe I'll get you to comment on what we should be looking out for in that landscape of how we create guardrails to protect citizens when we're talking about AI in healthcare.
Absolutely. AI is, these tools are predicted to dramatically improve the delivery of healthcare in Canada with accuracy, with speed, efficiency, and diagnosis. But like many jurisdictions in the world, the Canadian legal system kind of lacks this specific regulation or guardrails around the use of AI in healthcare, or use of health tech in healthcare. And there's, like you said, like there's every day there's a new story about who's talking about it. There's thought leadership globally on this issue right now. The Canadian government is working towards legislation. The G7 leaders met a few months ago in Canada to discuss data governance and data privacy and the challenges that AI in healthcare has from that perspective. The Canadian government, the federal government, just a few weeks ago at the end of September, rolled out a new voluntary code of conduct for advanced generative AI systems. This is not specific to in the healthcare setting. This is generally with respect to generative AI. And that is a voluntary code of conduct that sets out some practices and principles that players, developers, that users of generative AI systems can implement. And they relate to the principles of safety, fairness, and equity, monitoring and human oversight, robustness, accuracy, and transparency and accountability. So these are sort of high-level principles that we talk about generally with respect to AI. Even the industry itself of developers has called for help with the regulation and what should be the guardrails. This is not a legally binding framework. This is a voluntary code of conduct. There have been a group of early adopters that have signed up to say that they will comply. Others are kind of looking at it in terms of having persuasive impact on what guardrails that it will set for its own individual policies. When you sign up and put your name on a voluntary code of conduct, you're representing that these are the practices you're going to stick with. And so you can bring on kind of legal liability if you misrepresent what you're doing. The Canadian government as well has introduced a bill, the Artificial Intelligence and Data Act. It's part of the package of reform that we're seeing to federal privacy laws. It's at the moment a really kind of high-level framework about what AI guardrails should be, and with detail to be left to a later date, and kind of expectation that this would not come into force as law for a couple of years yet. And I think that's the impetus for sort of codes of conduct and trying to help support industry around what to do about their practices. I think, just before I kind of wrap up around regulation on this, like we saw with the updates to privacy laws to address technological change, we saw Europe as a leader. We're seeing that again around AI. So the EU AI Act is set to become the first comprehensive structure around AI guardrails in the world. And what they've done in Europe in this proposed legislation is to take a risk-based approach. So there would be certain AI systems that are outright unacceptable, things like real-time facial recognition in public spaces, creating health scores, very kind of framed on the risk to human harm to humans, and then stepping down from that, what's sort of in the very high risk category, and that will be highly regulated. Things like AI that could have the potential to influence voters.
It's certainly, we have a saying that AI won't replace doctors, but doctors using AI will replace doctors who aren't using AI. So understanding the
AI will replace the doctors using AI.
So understanding where we go in terms of the framework of the environment we're in is really helpful. We have a few minutes left. I want to switch focus to the patient, because that's why we do what we do in terms of healthcare delivery, and maybe we need to rethink how we see a patient. But we have built a system that's very provider-centric, hub-centric, hospitals and institutions. And Zayna, I just want you to comment on what you see as a future in terms of with the patient at the center of this mix, or how you see it.
Yeah, I don't like the word patient-centered, because it's still us putting this person here and then tapping ourselves on the back and saying, oh, we were patient-centered. So I think it's just so different. What it really is hyper-personalization. And personalization could be maybe because your biological signature, so we're tailoring based on like who you really are biologically. It could be based on your preferences. It could be based on language. It could be based on literacy, whatever it is. And that's, again, what a consumer experience would do is you hyper-personalize. And it could be me as a mom with 3 children who takes care of my mom, my siblings. Like, I'm the caregiver of everybody in my family as a 50-year-old woman. Maybe on Monday, I can't go to the hospital for X, but on Tuesday I can. Like, that's personalization. So it's not, we love to put everybody in one big segment and treat them. So to me, if we did that, if we gave way more choice and flexibility to the people impacted by the care, I think we would be patient-centered in the end. But we don't do that. We design to optimize for the needs and preferences of our systems. And then we wonder why we have the system we have.
Even when we're saying patient-centered, it's within the constraints of the system, not the actual individual.
Well, because at the end of the day, you're doing health care when a patient chooses to outsource their agency to a third party. When it's health, there's no health care. I'm taking care of my health, which, by the way, you and I do 80% of the time. We diagnose our own symptoms, we treat ourselves. But now when I need help, I'm in the realm of health care. And I'm saying when we're in that realm, which is a $330 billion enterprise in Canada, we have to be way better to hyper-personalize. And there's like 50 variables upon which you can hyper-personalize.
David?
Yeah, no, I mean, I think this is a huge lesson that we really need to take out of the pandemic. And we've moved at Seneca to, our vision is bespoke education in the sense of, tailored for the individual. And I think this is exactly and I tell you, from my vantage point at Khayat, which is a health technology assessment agency, seeing the kinds of treatments that are coming through, as you know, in terms of absolutely personalized, like right down to your genetic code. And that's how we'll treat your ailment, your cancer, your whatever it is. So this is absolutely the future. We also have to, and I like, I think you're right about that patient-centered word. That's a good correction. Because increasingly as well, we're trying to push things into, familiar and more comfortable settings for people, like home, as opposed to insisting on institutionalization. So that's going to be an absolutely important part of the future of future-proofing our healthcare system.
I think, yeah, go ahead.
The other part that is fundamentally different, that, if you look at first principles of how a healthcare system was built, is it was built for a minute period of a person's life where they fell sick, and then they interact with the healthcare system, and then they no longer interact with the healthcare system for years and years. That is how the system was built, and we're witnessing these challenges really mainly because of that design. And that was quite logical, because you couldn't put a doctor in everyone's pocket. And that's why the system is built this way. But wait, now we have a different world. Now we have a lifetime companion in everyone's pocket that follows your life through all the journey, through all the entire development of an individual. So that creates an opportunity to completely rethink what healthcare means and what healthcare system delivers, what health means to people, and really blend what we call wellness with what we call healthcare into this continuum of support of an individual on a highly personalized level, given the phase of their life or their condition.
I think this is a conversation we can have for about 3 hours here, but unfortunately our time is coming to a close. I'm going to get each of you, first off, I want to say thank you to each of our panelists, but what I'm going to get you to do just before we leave is, in 30 seconds or less, just give a quick call to action to whichever party, stakeholder that you think that you can really impact in terms of your voice, to say, how do we create a much more future-proofed, sustainable healthcare, either in Canada or abroad? So we'll start with Dana.
I think my 30-second sum up would be, I hope that innovators and industry participants stay committed to continuous improvement. I think that so much of our lives is dependent on a resilient healthcare system.
My call to action to business leaders to look at their role in supporting people they care about in their health journey. it's not just about the government to take care of it. We all need to play a role. And to innovators or to people in the trenches, certainly consider a view to new technologies like AI as an enabler and not as a competitor.
Thank you.
I think future-proofing the healthcare system or our health in general is a team sport. Everybody's got to be participating in that. Everyone's got to be at the table, and we've got way too many tables rather than bringing people together. And to me, the hallmark word is flexibility. Right? That's what I think. When you run into a problem in the system today, it's grounded in the lack of flexibility and the conservative culture that besets too many institutions. So if we can get that and get everyone around the table, we'll do great.
Agree with all, and I'll add 2 calls to action. If you're a user of the services and all of you finance the services, demand more. Just demand more. Your 9-to-5 life should feel like your 5-to-9 life, like you said, and you're in a time warp when you go to healthcare. And my second is those of you not in healthcare, in the last month, I've met with an oil company, a bank, and a tech company, another industry that all want to bring their capabilities to our sector. Come help us. We need all the capabilities we can get because, as we've heard, they're not indigenous to our sector yet.
Perfect. Well, on that note, I'll say thank you, and thank you to the audience for being captive, and enjoy the rest of the conference, everyone.